Today we celebrate our 100th episode.
Big 100. Today, we're going to just kind of highlight the things that we've taken away. A lot of the times we're able to educate ourselves here too.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled 100 Proof, a distilled look at what we've learned and lived after 100 episodes. Justin, my man, today we celebrate our 100th episode. What a crazy ride, bro.
Mazel tov, man. Big 100. Really awesome experience. We've been doing this for several years now. Obviously, we don't put out an episode every week, so we're at 100 episodes after a longer period. But it's been a really wonderful journey, and it's been great doing this with you, Kevin. And I always want to thank our listeners and our subscribers because I think that we've all learned a lot. And I think today we're going to just kind of highlight the things that we've taken away, because obviously our goal here was to educate the listeners, but a lot of the times we're able to educate ourselves here too.
Absolutely. Look, I took a look back. I got onto my Spotify, went down, got onto our podcast page, and I scrolled all the way down, and we started, or at least we released. I know we were working on it, doing all the brainstorming, getting the name Man Up all put together beforehand, but we released our first episode in August of 2021.
Damn.
That's
4 years ago.
4 years ago, which is nutty. We were very different people 4 years ago. Exactly what you said, though. We did this to really try to get good education out there on medical topics, but throughout the process, we've just learned a ton. Like, we're experiencing this journey, learning all sorts of stuff, butt stuff, everything. And
I like that you specifically said butt stuff.
Well, because we were talking about that.
No, we know what your priorities are. That's okay. Shout out Rosa.
All right.
Just came back from vacation. Obviously, we understand where his mind was.
Of course. But look, we've learned a lot. So I think maybe one good way to start this episode is to kind of just reflect and just maybe talk about some of the personal things from the things that we've learned doing this podcast that we've applied to in life. And Justin, why don't you start?
Yeah, I think, I mean, we can kind of go off back and forth here, but I think one thing when we started that I didn't do, and I'm ashamed to say, is I didn't lift legs at all. I, for a really long time, did not do leg workouts. I hated doing legs. It was my least favorite thing. I would be in the gym 4 or 5 days a week, but I never lifted my legs or focused on my core. And then, we've had enough of these episodes with specialists talking about the importance of your core, whether it's pelvic health, whether it's for, your back, that I was like, oh, I need to start doing legs. So, I started doing legs about 2 years ago. And one thing that I've always told patients that I didn't really believe was like, your legs are, I believed it, but I never felt it, was this idea that your legs have so much muscle, and you can feel the benefits overall of working legs. And this is probably a little bit too much information, but after I started doing legs, man, I was like, my libido was up, my energy was up, I felt stronger. I just felt better overall. And so that's one thing that I think I really want to harp on is if you're doing the exercise, make sure you're doing all of it. And I'm bad at that. And it's something I was guilty of for a long time. But I got to say that lifting legs has been one of the biggest, benefits that I've had over the last few years in terms of improving my overall quality of life.
Yeah, that was a great episode. That was episode 31 with Matthew when he came on and kind of talked about how you really got to just really attack your whole entire body, right? Or train your entire body. And I remember still our college days, you'd walk in the gym, every guy's got the big chests, they got the big shoulders, but they got the skinny legs. Everyone. It was without a doubt.
Chicken legs, baby.
Chicken legs. And I agree with you. I definitely do more legs now. I focus a lot more on just like kind of just overall core exercise, make sure each exercise I'm doing is trying to hit multiple spots. But yeah, that's definitely something that I've also kind of been more cognizant about. And especially now when I feel like injury is much more around the corner.
Oh yeah, dude. Oh yeah. We're old now. We're old.
We're old. We're old. Um, One of the things I definitely did, and I felt like I was not doing as well while I was living in Miami, but after our episode with Dr. Tim talking about skincare, now I'm like I have my skincare routine like down. And one of the main things is just making sure, I mean, and look, I know out there on Twitter or whatever, there's all these arguments about potentially putting on sunscreen or whatever. I am huge on it. Like I put sunscreen on my face almost on a daily basis.
Really? This is good.
Every day I apply a UV protectant just because I'm just so nervous about whether it's skin cancer or the development of wrinkles. So I have a regimen that I do, and that was something I did not do before the podcasting days. Like in Miami, rarely did it, but now I'm much more.
Yeah, that's great. Have you felt a difference or seen a benefit at all, or no?
I don't know. You tell me, Justin. Have you?
I mean, you never age, dude. You're an ageless guy. So,
That's probably
you
more the
know,
Asian genetics more so than
yeah, I
my
think it's because
skincare
you're
routine.
Asian, but no, I think that's a great point. I'm guilty of still not doing that. I tried it for about 2 weeks and I felt good about it, but then I just got lazy. So you're reminding me now. I have like literally bottles and bottles of like SPF 50, the
Yeah.
special one to put on your face. I have it because I agree with you. It's the important thing to do. I have family members who have skin cancer history,
Yep.
and it's something that if you want to look younger and you want to prevent yourself from getting wrinkles or increasing your risk of cancer, that's the answer for sure. But I also have been using more sunscreen than I have in the past. I'm from Jersey, dude. I'm not gonna lie to you. I used to go in tanning beds in high school. So I mean there is
Oh,
an
Dr.
improvement.
Dubin in the tanning bed.
I had a membership to Hollywood Tans in Wayne, New Jersey, RIP. And I don't go anymore, obviously, but I have been more skin conscious. Obviously, those are not good things. Don't do that. But yeah, it's a really good point. That's a good one. I like
Wait,
that one a
are
lot.
tanning salons still a thing?
Oh yeah, I had a patient the other day who came in for fertility. He tanned every day. He had tanned a couple times a week. He did hot yoga, and we changed those two things. He had no sperm in his ejaculate. We changed those two things.
Wow. 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 Very interesting.
So it was pretty cool. Amazing how lifestyle things can really change your fertility there. I think one thing that has become such a big topic, especially in the last few years, is supplements. So I think we always give recommendations. We had a lot of episodes on supplements, whether it's fertility, sexual health. And I've done a deep dive on this myself. And when I looked at the data, like people may ask, I've never told anyone, sometimes I tell my patients what I take if I take supplements. So first off, I don't take any testosterone. I don't take anything like that. But the supplements that I do take, I was always compelled by Tonkat Ali. And there was a point I tried it for about 2 months. And for me, it didn't do anything. That doesn't mean that it's, there's good, strong data that it does improve your testosterone. It can improve your libido. But to be fair, I also have a normal testosterone level, right? I was
No,
at six.
humble brag right there.
Right. I'm sitting in the high 600s, not to brag, but like there is a point. I don't know if there's a point of diminishing return with supplements for these things, right?
Sure.
So maybe I'm not the right person for that. I will tell you, I take a daily psyllium husk for like bowel movements and fiber. And I think that's a really good one that is easy. People don't like the Metamucil brand because it's the powder. I don't like the powder either. They have capsules that you can buy either on Amazon, you can buy at CVS or Publix. So I do like the capsules every day, and it's a great source of fiber that really helps me out, especially people may struggle to get the fiber that they need. And that's changed my life in a good way without going into the details of it.
I think we all know what that infers.
Yeah. And then the one supplement that I do take is L-citrulline. I take L-citrulline. I take it every day. And it's for several things, right? And it's a nitric oxide precursor, improve blood flow to all over the place, if you know what I'm saying. And I do think that there's a benefit. The clinical data is very strong on L-citrulline and L-arginine, and I'm a fan. That's what I'll tell you about that. What about you, Kev?
So the Dr. Dubin stack at current is L-citrulline with psyllium. So for me, I actually did take L-citrulline for a time period. Well, I think it was early on in the podcast days. And I definitely did I felt the benefits, right? Some guys use it as like a pre-workout, right? Try to get the blood flow kind of going. So I think
Oh, I'm sorry. I forgot one other thing. Creatine. I take creatine every day.
How about whey protein? Yes or no?
Yes, I also take whey protein. Okay. I forgot. I didn't count those. Continue. I apologize.
So my current stack, I don't take L-citrulline, but we had this conversation like a few weeks ago, and I think I'm going to add L-citrulline back because I do remember that time period I was on it. I definitely found, had benefits from it. Just never made it a habit to kind of make it part of my daily stack. But I do take whey protein pretty religiously every day, and I do take creatine. Now on Twitter, there's been great conversation about how like, wow, you got to take like 10 milligrams. I don't even know. I think it's doses like 10 milligrams or grams, whatever it is.
That's high.
Yeah, I do 5 daily.
Correct.
Right. But I do find that I think creatine, there is a lot of benefits to it. And so that's mainly my stack.
Yeah. I mean, listen, creatine specifically, 5 milligrams a day, it's like a tablespoon.
Yeah.
It's flavorless powder. I have it every day. There's really good data on, it's like it's pretty much the best studied supplement. And the data on muscle health, bone health, and now there's like mental health as well in terms of like acuity. And it's such a cheap supplement that I really recommend people start taking creatine. I'm late to the game. I only started about 3 months ago, really.
Okay.
And I think I do feel a difference in terms of like a little bit of muscle development. I definitely think that also I've been taking whey for my whole life, but so I usually only take whey though after I work. I don't take whey. You take it every day or you take it as a workout supplement? Creatine, I take every day, no matter what.
I personally take it every day because when probably about a year ago, I tried to do like an inventory on like, I did like a diary of what I was eating. I think this came after we did one of those diet episodes, and I basically tried to identify the macros and to see how much protein I was taking in, how much carbs, and I'm just very bad at taking in the amount of protein that I should be getting per day when I break it down. So for me, that protein, that supplement that I get from the whey protein really kind of gets me there. And I try my best to really try to get it through food and my diet, but I really do need that whey protein to get me there.
No, it's a really important point. And I have it at pretty much every day during the week because, one other thing that when we're talking about lifestyle things, I changed. We talked about weightlifting, and weightlifting, the more that we've done this in general, is weightlifting is so important. Resistance training throughout your life is so important for your longevity, for your bone health, for your muscle health. If you want to be active later on in your life, you really should be weightlifting. I changed my regimen. I'm going in the morning. I wake up at 6 a.m. every day before clinic. Obviously, I don't really go if I'm operating that day. I'll just go after. But that's also part of my new routine, waking up early and getting things done if I can. And it's one of those things where weightlifting, if you can do it, it should be, if you can exercise, I think that weightlifting over cardio is the ideal the ideal exercise.
Yeah, I completely agree. But it is important. The cardio aspect is still important, which you can kind of accomplish by just being very still active throughout the day, right? I do put some that there is some credence in getting your steps in because that just means you're just been active. And they talk a lot about all this, in the longevity podcast, they talk about level 2 heart rates and all that stuff. You're getting that as long as you're getting your steps in throughout the day. Do you have
a goal steps a day?
I mean, it's been set by Apple, trying to get your 10,000 steps a day, right? So,
do you hit it?
Usually, so if you want to talk about how I track my metrics,
let's talk about that.
So I use an Apple Watch pretty religiously, and I've probably used this for many years. I track my sleep. One of the new things I kind of actually just one of the downloaded things I downloaded is something called Bevel, but it tracks your stress. It gives a metric on for your stress, gives a metric on how well you recharge from your sleep. I think one of our guests came on and talked about how important, and we all talk about how important sleep is, but recharging and recovery is extremely important. You know, sometimes we're just thinking, gotta go, gotta go, gotta go, gotta go. And we can talk about that a little later about how its impact on potential fertility, but it's important to get rest and let your body heal up. And that's how you can, otherwise you're just going to plateau because you just don't get that recovery process. So I use the watch and it kind of gives me some nudges, gives me some idea of like, you know, your recovery was not so great. You didn't get that great sleep the night before. So maybe on your workouts today, maybe just kind of hold back a little bit so that way you're not going into too much debt that your recovery the next day has to be even more. So that's what I use.
I don't use any smartwatches. I'm not a big watch guy. I don't like micromanaging. I'm not saying this is the right thing. Like, I think for me, a lot of I keep track of my steps through my phone, but that's about it. I have a goal of steps, but I think that a lot of those things would create more stress in my life. So I stay away from it. And that's just my stance. I have a general gestalt. I don't calorie count, but I have an idea what I'm eating, how I'm taking it in. I understand the calorie intake of all of these things. But I think that all of those additional things for me increases the stress of my life. So I'm going to stay away from it and not worry about micromanaging all those things. That's just how
Yeah,
it
it's a
is.
fair point. It's a fair point.
All right. So, we talked a little bit about our diet, our supplements. Have you changed your diet at all? Now, I think that this is something that in general, I don't know how much I have because I've gone through waves. I think for many, many years, I really reduced my red meat, and the data suggests that you should. I was eating maybe a steak every 6 months. I'll be honest with you.
Wait. You now currently eat a steak every 6 months?
No, that was like years ago. Now I'm eating more red meat. I don't
Oh,
know if
okay.
that's
Yeah.
a good thing or not. I'm
I'm
eating
pretty
a
sure the
lot more
last time
red
we hung
meat.
out, we ate red meat.
Yeah, that was like, I would say 2 years ago, 3 years ago, I started eating more red meat. I don't know, it's obviously not great, but when I do try to eat it, I try to make it grass fed. I try to make all my foods and my fruits organic. It's a little bit more expensive, and obviously that's not reasonable for a lot of people, right? But I've really tried to remove a lot of. I've never been a processed food guy in general. Like I don't eat cereal. I don't eat, you know, canned things. I don't eat jarred things.
Just when
Most
you're
of
on
the
an airplane and then you
just
eat
when
the
I'm on an
snacks.
airplane. Yes. But if I have something, it's maybe air popped popcorn. I try
Yep.
not to even get it exposed to like the plastics in the microwave. So I really try to make everything that I'm eating for the most part. Now, most of my diet is a heavy Mediterranean diet, though. I use a lot of oils. I have increased my white rice consumption a little bit because I used to be such an anti carb person, but there's value in some of these carbs and potatoes and sweet potatoes. So I have had a shift of my diet a little bit, but everything in moderation is kind of my rule here, but mostly Mediterranean.
Well, that's good. I'm still remarking on that one time you only ate steak for every 6 months. That's quite amazing.
Yeah.
Um, so for me, ever since we, sat with Dr. Loeb and she talked about such positivity on the effects on vegan diet, in particular with her studies in prostate cancer, I've tried to definitely be more cognizant to increasing just the cognizant the idea. There's no way I could ever go full vegan. I've tried. It's just impossible. So now the way I make it easy for myself is I just throughout the week, I just make sure I kind of hit a protein throughout the week. And then, so I get my beef in, red meat, right? Make sure to get my chicken, lean meats in, and then get my fish in. And then those rest of the days, I try to lean a little bit more towards, vegan, the tofu, and just try to be more veggie. And then again, that's kind of why I kind of fall a little short when it comes to like the protein intake, and I kind of supplement with the whey. But in terms of sourcing it, I definitely, with all the stuff that we talked about when it comes to like endocrine disrupting chemicals and all that stuff now, I try to find more like, these farmers markets, locally
Yeah.
sourced food is kind of like, you're like, that's the good stuff. And unfortunately, and then, at one point I was like, this stuff's just way too expensive. But with everything's going, things become much more comparable. And I'm like, locally sourced stuff where it's not coming from far away, you kind of have an idea where it's coming from, is most likely probably going to be good for you. Look, I know it's not going to be feasible for everyone, but I think just being cognizant, and if you have that option and it's within reason, I think it's something that, I would recommend.
I think it's an amazing point. And beyond eating healthier and eating better, you're supporting local, which also makes a difference, I think, is also a nice aspect to it. But you're right. If you can, the rule I think is if you can farm it or you can kill it, it's probably something okay for you to eat, especially if it's within your mileage range.
Right.
But obviously, I'm not asking you to kill animals. But I think let's move on to the big topic, endocrine disrupting chemicals,
Ooh.
right? Because this is something that we had 2 episodes about. It's continuing from that conversation. It's been a conversation I've been having nonstop with my patients, nonstop on social media. We've had multiple episodes between that and microplastics. So out of all those things, Kevin, what reading all the material, having our talks on, the episodes with Dr. Swan, our episodes looking at the literature, what are you doing in your life right now to reduce your exposure to endocrine disrupting chemicals and microplastics?
So, look, that episode has weighed heavily, or just kind of been in my brain ever since we did it, even before leading up our pre-work, as we were kind of like reading up on it, reading Dr. Swan's book. It's the evidence is pretty strong there. So for me, almost everything that I do, I always kind of, it doesn't make me go like, hey, I'm not going to do it, or like, this is going to 100% change the way I do things. But I am much more cognizant of, number one, like takeout. Like takeout has gone down like significantly for me.
Wow.
The idea of just like hot food or anything sitting in the plastic now actually kind of disgusts me. Like kind of like really, really makes me adverse to even eating it. So that's one thing, because the stuff comes in piping hot in a plastic, whatever, plastic bins or even those Chinese takeout cartons. So that's one. Second thing, I mentioned it on my IG story. Now, like coffee, like the idea of like the traditional coffee makers where you're just dripping hot water through like the plastic things. Now I do a pour over where everything is just coming into a ceramic thing, and that hot water doesn't touch any plastic. So that's a thing that I've made a habit. That's the only way. And sometimes when I travel, I bring it with me because it's so small, but that's because that's the only way, if I'm in a hotel or something, that I want to have my coffee done. And so those are like the main big things.
Well, let me ask you, because I'll bring up my points, but I think a lot of them are not applicable to people who have young children. Now, obviously, a lot of the concerns are for people who have kids or they're pregnant or trying to have a kid. Now, are there things you've done to change? Like, obviously, your kids aren't drinking coffee, but the takeout will impact them. Are there things that you're changing in your life with regards to changing the exposure for your children to endocrine disrupting chemicals and microplastics?
So that's an excellent question. And my wife and I when we did that EDC episode, we had like a general pretty newborn. She was about like less than 1 year old. And one of the things is we're so used to using bottles, like plastic bottles, to carry formula milk or breast milk or whatever it is. And then you reheat it up because it's, you're taught the babies like it warm. And so one of the things that we kind of changed towards the end, didn't do for our first kid, but we changed to kind of more glass bottles. And I'll tell you, more of our friends who had young kids changed to glass bottles. Glass bottles were actually what were used back probably when we were kids and our parents were feeding us. Glass bottles were much more prevalent, but because plastics came out, they were much more easier to clean, much more easier to bring around, most importantly. They became more prevalent. But now, just being more cognizant, you're like, that's probably not good. And so that's one of the things. And there's all this talk about different types of processed foods that carry a lot of these potential microplastics in them. We've just been more cognizant to not give those to the kids.
Now, because that's my question, because I've changed all my silverware. Everything is either metal, it's ceramic, or it's glass. Now, with kids, I tell people that, but they're like, I have kids, I can't have a glass cup. But I think there's like silicone that is like endocrine disrupting, chemical free, microplastic free. I don't know if you're using those. Are you using those at
Yeah,
all?
so even like and when it comes to like the water bottle for the kids, the water bottle, like before it used to be all plastic. It was popular, just everything plastic. But nowadays, no, it's it's like the same kind of metal that you get from like a Hydro Flask or from a Yeti. That's the one I carry, and it's a silicone top. The thing is, it requires a straw. That straw is still plastic in there, right? You can't evade a lot of things. It's just inevitable. But I think just being cognizant and trying to minimize, right? And no one's saying you have to have zero exposure. That's impossible, right? Unfortunately, it's impossible.
It's literally impossible.
You got PVC piping like throughout, it's inevitable. But I think trying to minimize it and making sure it's not in every part of your daily life.
Yeah, I mean, listen, I've also done a couple other things. I've changed my underwear for a lot of it.
Shout out
a couple of nads.
Yeah.
Shout out to them. I'm gonna give Silk also shout out to them. Shout out to Mr. Fertile. I'm gonna give a couple of shout outs to several different underwear companies that are all endocrine disrupting, chemical free,
and they're just as comfortable, right?
Phenomenal. They're all excellent, really comfortable. They have boxer briefs. So I've done that. I've changed shampoos, Modern Mammals.
I've actually a shout out to them that I actually use their shampoo all the time. It's awesome.
I use it exclusively now.
Yeah.
It's actually really good. And it's it feels like it preserves your natural oils, and that's the goal of it. It doesn't have like an overbearing smell, so you feel like a man. Pretty much change shampoos. I just changed my deodorant, my detergent, my dishwasher detergent, my laundry detergent.
Okay.
Truly Free is a company. Shout out to them.
Okay.
So there's a lot of different things that we think of that we don't think of that may have exposures, and those are some interesting ones, right? So we're talking about detergents, we're talking about shampoos, we're talking about clothing, and a lot of people are moving towards more natural cotton and things like that, including in shirts. Bamboo. Shout out to Cozy Earth. They're bamboo based, which is also microplastic free.
Yeah.
Bringing in all the former sponsors here. So I think that when it comes down to it, I think your summary was great. It's impossible to remove all of these things. Don't stress about that, but understand that you can make a difference in reducing your exposures. And reducing your exposures may impact your health, your children's health. If you're pregnant, maybe the child's, data's out there. I'm not saying it's the most compelling, like we're all doomed, but I think it's compelling enough clearly that you and I have both significantly changed some of our lifestyle measures. Would you agree with that?
100%, man. 100%. And it's an ongoing thing, right? It's like and I love the way, Justin, that you put it, where you like each thing now you've encountered, you're like, hey, I can make that change, right? It's not like been like, I can't do that anymore. Or it's like you draw a line. It's like, oh no, there are plenty of alternatives out there. It's great. The world we live in, there's so many different options, but you seek those alternatives and make it a habit and get it in part of your life, and you're minimizing your exposure. Look, I want to switch it up a little bit, and I want to ask you a question because, and this is going to be applicable to you as you see future patients, you as a physician in the future, but look, artificial intelligence is here, right? And we did an episode with Dr. and that was a fantastic episode, just really enlightening of where things are headed in terms of medicine and artificial intelligence. So I'm going to ask you, all right? I want in particular for our listeners, like how should they be using AI, like their approach to all these things? So we do this podcast because there is so much misinformation out there, so much, right? These TikToks that preaching stuff that is just complete bullshit, right? And so we want to bring experts on and all that stuff. But now you got AI where you could ask that question. Now, at its current state today, how should our listeners use that for something they may be concerned about?
Well, this is a really good and important question. So the first thing we have to know that is, like we talked about in that episode, that AI seems smarter than us. In general, it is smarter than us. but it's not always truthful. So you can't trust anything. Literally, we were prepping for this episode. We asked
Yep.
AI to summarize one of our episodes.
Yeah.
What happened, Kevin? What happened when we asked it to summarize our episode?
Yeah, we wanted to go through. I was like, hey, look, just give us some of the quotes from a particular episode. Said episode by Dr. Justin Dubin, Dr. Kevin Chu, and then had a completely different guest that we've never actually had on the show. Had full stories as if like we had the conversation, which we never recall, never even talked about that topic, and had like quotations on it. So, again, you get led into this trap where you're like, hey, this thing's got to be giving me the correct information. And the whole thing was a complete farce.
So it makes hallucinations, right? That's, I think, the word that it is, right? It's a hallucination. And so I think that we have to treat AI when we're learning about our health and learning about our other things with the same way that we treat social media. And it starts off, with a question. What am I trying to learn here, right? What am I trying to learn? Am I trying to learn about a disease? Am I trying to learn about an intervention for a disease? Am I trying to learn about a product or medication or some kind of exercise or approach towards that disease or problem? That's one. Two, where am I getting this information? And that sounds funny from AI, but actually it's important, right? There's different AI chatbots that, we've done publications on which ones provide better medical information. We know that they're working on some urology and medicine focused ones that can provide more accurate information when it comes to specific topics. So you want to make sure you're using, the right the right AI engine, or understand in social media, whether you're using YouTube, TikTok, whatever, like, is this a really good source, or am I better off going to like Mayo Clinic, Johns Hopkins, or going to, these legitimate websites, SMSNA, ASRM. Three is like, who's giving me this information, right? Obviously, the question is AI in this situation. And when you look at that, you have to understand AI doesn't know it all. It makes shit up sometimes. And especially when you get more specific in the weeds of medicine, the hallucinations are probably going to increase, and they're going to sound smart, but they're not saying anything, right? So that's important. On social media, is it a doctor? Is it a healthcare provider? Is it a nurse? Is it a PA, nurse practitioner? Or is it some 18-year-old dude who's telling me why, he just hasn't come in 3 weeks, and he's like, his teeth's through the roof, his skin looks great, and his hair is beautiful. So, who's giving me this information? And four is, do they have an outer prerogative, right? Like, are they selling me a product? Do they work for a company where they're selling a product? Are they selling an intervention? Why are they telling me this information? Is it just to educate me? Are they providing me with information there? AI is obviously, it's mostly to educate. It's not to motivate you to do anything, but there's really scary shit going on. You never really know based off of what engine you're working with. And then the last thing is, what am I going to do with that information, right? Am I going to go buy a product? Am I going to go go online and purchase, or go to some direct to consumer? Am I going to go talk to my doctor about it before I do any of these interventions? The answer should always be talk to your doctor, whether it's a primary care, urologist, OBGYN, whatever it is. You shouldn't be doing something to your body without talking to a healthcare provider of any kind. You probably shouldn't be trying random supplements. You probably shouldn't be trying random over-the-counter ED medications that can really mess you up. You probably shouldn't be spending $900 on a device that claims to do something if you don't even know if it's really going to work. Because remember, and we've seen this before, we're going to continue to see it. You're going to hear podcasts talk about it. You're going to see it on socials. Basically, the idea here is that people are going to push you shit. They're going to give you crap, and people are in it for themselves most of the time. We really have to be careful about the information that we get. We have to be careful about how we consume that information, because at the end of the day, at best, you're going to waste some time or delay your care. At worst, you're going to spend a whole bunch of money or take something that's going to really harm your health and make your problem worse. So, that's what we're dealing with: AI, social media, and all the above.
Well said, man. Well said. I mean, I think AI it's here to stay. And I would be lying if I would say that Justin and I don't use it. We kind of use it quite often. The amount of literature out there Like, as much as we are well trained and, have gone over so many studies, there's just constantly new studies coming out. And what AI does help us do is kind of get that information. But I will tell you, we still, like, even if something's summarized, we still go and take a look at the primary source, because there's still a huge element that I'm like, I still don't trust whatever interpretation they got. So I get a general sense, and then I go in and I just still vet to make sure that that statistic or whatever thing that they pulled out from there is accurate. So I think it helps in many ways, but at the end of the day, you want to go to the primary source. So if you're having a health issue, like, sure, you can get some sort of educated on it, but I wouldn't say 100% rely on it. You still want to go to primary sources that truly understand how to treat the ailment. And, these are healthcare professionals. These are physicians.
You're right. You're right. And then listen, anyone can read a study, but it takes years and years and years in training to understand what the study actually means,
Right.
understand the implications of the study, and to also understand if it's a good study, right?
Yeah.
And
Yeah.
you can find a study supporting any aspect of
Anything.
And that's what people online do. They go, well, this study says this. It's like, holy shit, there's like 100 studies saying the opposite of it.
Yeah.
You found a study. It's like, well, this ancient study from 1965 says that this. It's like, dude, it was on like chickens, and like it doesn't even make sense. We've had 40 studies, but we have to believe the one study that came out 60 years ago.
Or so, two people of this study had this effect. Applies to the general population. Has to.
Correct. It's crazy. Yeah, I mean, it's there. It's a valuable tool. So is social media, right? You have to use these things with caution. When in doubt, really ask someone about it, a healthcare provider. Let's pivot again. I know we're running a little bit long, but this is really important, because one topic that continues to be very, very popular is fertility. Men's fertility. Kevin, like, out of all the years of doing this podcast, you're a male infertility specialist. How would you break down to someone who's listening to this right now, or recommendations for optimizing your fertility, or even learning about your fertility, even if you're not ready even to have a kid yet?
Well, so the most important thing, and it's even as a specialist, talking to other specialists, one of the things that is a constant recurring theme is that, male fertility is kind of a window into your health, right? Into the male health. And so if you want to think about it, if you want to kind of think about maximizing your male fertility potential, you just got to live a healthy lifestyle. And I just tell guys that is just from day one. And it's, it's things we talked about, right? Just having a good diet, right? Being cognizant of that, exercising. Now, maybe don't exercise too much. Don't have like constant high intensity workouts that may lead to like poor recovery, but have good exercise and really stress management. I really do think stress is like this huge thing, especially in our generation, that really weighs down and maybe causes a lot of idiopathic infertility. And so stress management is huge. And those are like the three pillars I say. I was like, you got those three things, really manage it. And also include like, hey, make sure you're not like drinking a bunch of alcohol, smoking a lot of weed, all that stuff. Just having that maximizes your fertility potential. You're doing what you need to do. Everything else, maybe just some cards that are unfortunately handed to you, and that's where specialists can kind of step in and try to help. I don't know if you have anything else that you...
I think it's a great point. I think I'm just throwing out random numbers here. I don't even know if it's real, but so I'm not going to give a number. I'll just say the majority of people who come into my office with fertility issues, men, have correctable things that they can do to improve their semen parameters and improve their fertility. That's right. The majority. Most of them do not have a genetic disorder. Most of them, may have some kind of, varicocele or something, but it's still something else is going on oftentimes, where most of these guys can do something in their lives to improve their fertility that doesn't include a medication, that doesn't include a surgery, that doesn't include any other interventions that they can do, whether it's sleeping better, exercising more and losing weight, eating healthier. What else did you say? Decreasing stress. Those are all important things. The other thing I would say is more and more we've talked about testosterone replacement therapy.
Yeah.
Taking testosterone kills your fertility. I saw 4 people today literally on TRT or recently on TRT who are coming to me now with either low sperm or zero sperm in their ejaculate. Once again, this is something that can either be prevented or you can be recovered from. But ideally, it's something that can be prevented. If you're interested in having children in the future, you should not be started on testosterone replacement therapy, the real deal testosterone. Now, there is some controversy whether you want to put HCG with testosterone. Sure, you can. I prefer not to. There's some data suggests that it is fine. It'll save your sperm. I have a couple patients who we saw we tracked it. Their fertility declined. It stayed, but it wasn't good enough to do natural conception, maybe IVF. But you're talking about a significant difference in cost for your fertility. I think that that's probably the other big thing here. Kevin, anything else I'm missing here or thoughts?
No, that's an excellent point. And in that subset of patients that are doing testosterone with HCG, at least they are cognizant of what they are doing or going in. Like they're aware that TRT, but it is so easy now. Like, I pop on some of these websites. It is so easy to get testosterone replacement therapy nowadays. And Justin, you've done the studies as well too. Like that education is just not there. That counseling is just not there. And so, that's an excellent point you made there. It should be a banner everywhere. It should be slapped on TRT bottles, just like how smoking, potentially causes lung cancer. Hey, TRT will cause, infertility, transiently, if you want to call it that, but still causes infertility. And you should know that before you start it. If you start it and you know it, well, that's the decision you made, but you should know that.
The other thing that drives me fucking crazy is that you're given medications like Clomid and gonadorelin, which you're being told is going to preserve your fertility, where the people giving you that don't understand how the medications work and they don't understand physiology. Because I can guarantee you I had the conversation today twice. Giving you gonadorelin is up here. It treats your brain. It's going to go against testosterone. And I don't think there's any data on gonadorelin showing that it's going to work because it's going through your brain. The same thing with Clomid versus testosterone. It's probably not going to work. The only thing that will work,
Wait. Would you say Clomid doesn't work?
I don't think Clomid with testosterone works.
Oh, with testosterone. Okay. I was a little confused. Yeah.
I'm
Okay.
saying when we're talking about combos.
Combos. Okay.
Testosterone, gonadorelin together doesn't work. Testosterone, Clomid together doesn't work. The only combination with testosterone that will potentially work is HCG, and there's no guarantees because the way HCG goes is it bypasses your HPG or at least the HP part and goes straight to the G. The other ones are playing on your hypothalamus and your pituitary, which obviously are getting shut down and overpowered by the testosterone you're taking.
Which is like the whole idea of why, we, in patients who are on TRT who are trying to maintain ball size, it still works to give HCG. Right? You're not giving Clomid in those cases. If you did, you probably wouldn't see those results of preserving testicular size.
Right. And the other final thing about fertility that I think we really need to harp on is the stigma associated with it. 50% of guys, 50% of couples with couples infertility, there's a male factor involved. 30% of the time, it's strictly a male factor. And yet guys don't want to get worked up. I think the data shows about, we're only capturing about 20 to 30% of patients who need to get worked up as men, even though they're contributing 50% of the time. There was a great paper out of Northwestern. They surveyed men. They said, are you concerned about your fertility? And they said, are you willing to talk about it? And only 30% of men who were concerned about their fertility were willing to go talk to a doctor. If you are with your partner and she's getting worked up, you need to do your part. I say it all the time. Your best ability is availability. And that is something that you need to do. The workup is quick. The workup is easy. It's an exam, blood work, semen analysis, and a quick history. The female exam evaluation is much more invasive. The least thing you can do is go see a doctor.
Sperm is important. Sperm is very important. It was, for a long time kind of dismissed as like, hey, there's so much of it, it should be fine. But we're really learning that sperm is rather important in the whole thing. And just like you said, there's really no excuse. You got at-home semen tests now. You don't want to go into a lab, order a box, sit in your room, and you'll be able to get results.
Shout out, fella.
Shout out, fellow. And so, but that, that's that our science has really come so far to allow us to be able to do that and get reliable results. It's a great time to be a dude. You don't 15 years ago, you had to go to the lab and, there was no mobile phone. You had the magazine that was used by, 10 other dudes earlier that day, so we're living in great times. You got no excuse not to be knowing your, semen parameters if you're, getting worked up.
Yeah. Well, what are your thoughts to men if they're just interested in learning? Do you think it's okay to just get a semen analysis?
I am. But again, I'm the guy who's wearing an Apple Watch, knowing about his sleep, knowing all that stuff. I think we live in an age where you can get your biometric information if you want it, right? It's out there. And, there's many physicians kind of straddle this line of like, oh, sometimes too much medical information is not helpful. It's just a lot of noise, right? For me personally, as we keep entering in the time of like where AI is giving us a lot of tools, I'm a very big data guy. And I say, hey, look, if you want to know about it, your semen analysis, and you're 19 years old and you're not planning on having kids for 10 years, I'm still okay with it. Because it's there. I don't know.
I agree with you. I think that even though I'm not like a big data all the time guy, you said it before, your fertility is a window into your overall health. And if you're not healthy or you're not feeling good or you just want to learn what your status is, maybe that might be the motivation to get you healthier, right? Maybe this is like the wake up call you need to see what's going on. Maybe you're thinking about having a kid in 2 years, but you want to know where your status is now. And I think that if you're interested, you should do it. The risk is low. The cost is low. It's not it's pretty damn convenient. I mean, I don't see why not, right? And I agree with you. And the guidelines still kind of say wait a year. But I think if anyone's interested in their fertility, if anyone's interested in learning about their health, we are for that. Go learn about your health. Go talk with them. I have guys come in. They just say, hey, listen, I just want to know where I'm at. And that's becoming more popular.
Oh, yeah.
Which I think 4 years ago, we didn't see that.
No.
So, I mean, there's a lot of good things going on in the space. People are becoming more comfortable talking about it for sure.
Absolutely. All right, Justin, we're getting up close to an hour here, but final thoughts. This is our 100th episode. Final thoughts.
We went longer than we thought.
Yeah, we did. But final thoughts. So just in general, it doesn't even have to be just, it's our 100th episode.
I think in general, first off, thanks for everyone for listening and being part of the community here. It's pretty crazy, 100 episodes, really cool. And in our journey, like I said in the beginning, I really learned to improve myself. And I think I've become a better doctor listening to everyone's stories, listening to these people come on. I think I've become a better communicator in the office with patients, in the public. And so this has been a real blessing to me in my career. So I want to thank everyone for listening and joining in that journey. But the conclusion I have is like why we started this in the first place is, we're here to really destigmatize conversations in health. We're here because men's health, as much as we've talked about how much it's advanced, it's still something a lot of guys don't want to talk about. And we need to have a place for good, accurate information. And hopefully we've become one of those places for you. And this is not just us. We're hoping this motivates you in your journey to improve yourself, to be a better person, be a better man, be a better partner, be a better father, be a better worker, whatever it is your goal is, it all starts with your health. If you're not taking good care of yourself, nothing else matters, right? Your sexual health is health. Your fertility is your health. These are all windows into your overall health. If you want to have the best sex of your life, if you want to have the best erections of your life, you better start taking care of yourself now so that when you're 70 years old, you're still doing what you're doing now. It doesn't happen overnight. These things take years. This podcast took 4 years to get us to 100 episodes. It's going to take us a fucking million more to get to episode 200. Well, we're all improving. Shit, my camera died. See, look at that. That's
great. Man. All right. That's a sign that it's about time to go.
Kevin, you finish up.
Well, that was well said. That was well said, Justin. That was very well said. Look, I mean, I just want to thank the listeners. We're 100 episodes. You know, when Justin and I first started this, we decided we'd record on a Zoom. You know, we recorded our first episode on Zoom. I'm pretty sure we were both shirtless, with some substitute mic. And but we've evolved, as we try to kind of educate, we want people to kind of live better lives. For us, we've really evolved also just trying to be better communicators, better podcasters. And so it's been very exciting to see how we've changed, to get the feedback from our own community, from our patients. I'm really excited. This is episode 100. I'm really excited to see what we'll be at episode 200. I think we have some ideas how we're going to further evolve. So, but thank you to the listeners, and that's about it, Justin.
Thanks, guys. To 100 more, and download, subscribe, review 5 stars, baby. Until next one, have a good one, guys.